Welcome everyone. In this video we will talk about can antibiotics cause diarrhea. Antibiotics can commonly cause diarrhea as a side effect. When you take antibiotics, they can disrupt the natural balance of bacteria in your gut, leading to a condition known as antibiotic-associated diarrhea, AAD. Nearly all antibiotics can potentially cause diarrhea, but some are more likely to do so than others. The antibiotics most commonly associated with causing diarrhea include penicillins, cephalosporins, fluoroquinolones, and clindamycin. These antibiotics can upset the balance of beneficial bacteria in the gut, allowing harmful bacteria like Clostridioides difficile, C. diff, to overgrow and cause severe watery diarrhea. The risk of developing antibiotic-associated diarrhea increases with longer courses of antibiotics and in older adults. Diarrhea can occur during antibiotic treatment or even up to 2 months after stopping the medication. Symptoms can range from mild, occasional loose stools to severe, frequent, and watery diarrhea. In most cases, antibiotic-associated diarrhea is only a mild and temporary issue that resolves on its own after the antibiotic treatment ends. However, in some cases it can lead to more serious complications such as dehydration or the development of C. diff infection, which can cause severe bloody diarrhea, abdominal pain, and even life-threatening inflammation of the colon. Older adults and those with weakened immune systems are at higher risk for these complications. To help prevent or manage antibiotic-associated diarrhea, healthcare providers may recommend taking probiotics, which are supplements containing beneficial bacteria. Studies have shown that probiotics can help restore the gut microbiome and reduce the risk and duration of antibiotic-associated diarrhea. Drinking plenty of fluids and eating a diet rich in fiber can also help. In summary, antibiotics can commonly cause diarrhea by disrupting the balance of bacteria in the gut. While usually mild and temporary, antibiotic-associated diarrhea can occasionally lead to more serious complications, especially in older adults and those with weakened immune systems. Taking probiotics, staying hydrated, and eating a fiber-rich diet can help manage this side effect. For more information, please go to the description. There is a lot of important information for you. Finally, thank you for watching this video. Please subscribe to the channel to receive everything new. See you in the next videos.